Hi, I'm Dr. Shilpa from Bangalore, a practicing gynecologist. Today we will discuss about hysterectomy. So hysterectomy is a procedure where we remove the uterus, and this is a procedure which is done when there is a conditions like fibroid uterus, endometriosis, adenomyosis, prolapse uterus, or in gynecological cancers. So hysterectomy is one of the commonest surgeries that is performed across the world on women. So what is the ideal age to get a hysterectomy done? It depends on the medical condition of the patient from which she is suffering and for which the hysterectomy is indicated. Also, it depends on factors like whether she wants to retain her fertility, whether she wants to have more children, and whether she wants to continue menstruating. So this decision usually is taken between the patient and her clinician, depending on so many other factors. Ideally, we don't prefer to do the hysterectomy before the age of 40, and we would like to preserve the uterus and find out other options which can work for their conditions that they are suffering from. So the hysterectomy can be divided as total hysterectomy, where we remove the uterus and also the cervix. It could be a subtotal hysterectomy or a supracervical hysterectomy, where only a part of the uterus is removed without actually removing the cervix. The other type of hysterectomy is radical hysterectomy, where we remove the uterus, both the fallopian tubes, both the ovaries, and also few other structures like lymph nodes, peritoneum inside the pelvis. So the various routes of hysterectomy could be one, abdominal hysterectomy, wherein we cut open the abdomen like a cesarean section and remove the uterus through that incision. It could be a vaginal hysterectomy, where we remove the uterus through the vaginal route, where the incision will be there only through the vaginal route and the stitches will be there only in the vagina and nothing will be there onto the abdomen. The third type of hysterectomy is laparoscopic hysterectomy. Laparoscopic hysterectomy is where the whole procedure is done through a laparoscope, where we put 3 ports, that is 3 holes, about 10 millimeter one port and 3 of the 5 millimeter ones. And with these ports, we try and do the surgery where we remove all the attachment of the uterus and we remove the specimen through the vaginal route and do the suturing of the vault either through laparoscopy or from the vaginal route. So hysterectomy again is a choice which the patient will take depending on her medical condition, and this is a last resort for many of the conditions that a patient will be facing. So in our practice, in about say like 10 to 20 cases that we see with patients who have gynecological disorder, at least 10 to 20% of them will require hysterectomy at some point in time for the indications that I have mentioned before. So being aware about the procedure and also about the choices that you have is very important when you decide to do the hysterectomy. There is another hysterectomy which can be done using a robot, which is called robotic assisted hysterectomy, which is not very common at this point in time because of the availability of the robo and the skills which is required to operate on the robo and also the cost factor.